Now from Capitol Hill is Democratic Congresswoman Loretta Sanchez of California. Good afternoon to you.
Hello, Martin. How are you?
Good, thanks. Congresswoman, you just heard the Speaker. Republicans are going to keep on collecting stories, though they have no idea what they may or may not do with them, as long as they hurt the Affordable Care Act. That sounds like a productive agenda, doesn't it?
Well, we've continued to see over this year the 45th, 46th time for them to try to eliminate the ACA, the Affordable Care Act. What I have told my colleagues on the Republican side is come and help us get this right. I know, I'm a Californian, lucky for me. We have a state legislature, a governor. We have covered California, which is our exchange. We all decided from the very beginning we wanted to make this work. And as you've seen, the numbers have been surging in California. We have hundreds of thousands of people who have already gotten their plan. And I'm starting to get the phone calls. They're starting to turn around from, oh my gosh, I'm so scared about this, Loretta, to, hey, did you know I just saved $300 a month on my plan, and I'm so grateful you voted for this.
Well, you say that, Congresswoman, but even as officials today say they fixed 2/3 of the high-priority bugs on the website, you see states like California showing growing enrollment, states with Medicaid expansion slashing their uninsured rates. Why don't Republicans turn their newfound enthusiasm for healthcare access to those particular role models?
Well, they say that they want affordable health care for people, but honestly, they didn't really help us to get there. They didn't, we over 300 amendments from Republicans that were voted into this law. They really did have a say as we went through this process of making this law. But for some reason, they have wanted to disengage from this. They have wanted to eliminate it. That's really sad, because at the bottom of all this, what we want to see is to bend, as we say, the cost curve on health care and bring it down in line with inflation, not these 17, 18, 35% increases that we have seen year after year in these plans.
Right.
And I think that this is what ACA will do. It will bend the plan down. It will put more people insured. It will have less people having to go to the emergency health room when they have a need for a doctor.
Yeah. Well, as you're defending the healthcare rollout, the president, as I said earlier, is actually at this moment at an event for the Wall Street Journal. He's been taking questions on everything from cybersecurity to climate change, and he's also addressed the issue of the healthcare rollout. The New York Times editorial board puts it this way: what is the Republican alternative to this government program, flawed as it is right now? There is none. Party members simply want to repeal the health law and let insurers go back to cancelling policies at the first sign of a shadow on an X-ray. They have no immigration policy of their own. They have no plan that will stimulate job growth. They are in favour only of shutdowns and sequesters and repeals. It's true, isn't it? That is the Republican agenda. Sequester, shut down, repeal.
Well, it's always never black and white. You know that, Martin. There are some Republicans who diligently have been working with us on some things to try to get them passed. There are a few immigration reform. There were some who came out publicly on the shutdown. But overall, the majority, especially here on the House,
what about the leadership? What about the leadership?
And the leadership has gone along with these Tea Party guys who are not about how big or how small government should be, but about no government. And so it's really sad to have seen the leadership follow that. I'm hoping, I can only hope, I can only talk to them and say, stop following these 40 guys and get yourself together and help us to move this country forward.
How good does it feel, finally question to you, how good does it feel for you as a representative in a state where those millions of people who previously had no insurance coverage whatsoever are finally able to get some?
Yeah,
that must be gratifying.
My staff has incredible stories. I had a woman crying on the phone the other day saying she had a pre-existing condition, diabetes. It's for her, it's more genetic than anything else. It runs in her family. It's something that is so close to me. And she was crying saying that for the first time in 9 years, she finally got a policy that she can go and see a doctor and not be afraid. I think this is great. I know for my district, for the people I represent, so many of them will finally have an insurance plan. And we worked very hard to put clinics, to put doctors locally so that, you know, they wouldn't have to take 15 buses to get to the hospital or to get to their doctor. We're pretty excited about seeing this roll out in California.
It's a wonderful anecdote. Congresswoman Loretta Sanchez, thank you.
Thank you.